Hi, Namaskar, good evening to all. I, Radhika Garwal, welcome you all in today's webinar. Someone has rightly said that for beautiful eyes, look for the other in others. And one thing that cannot be neglected. Therefore, to maintain these beautiful eyes, we all need to pay attention to our eye health and eye care. We are quite happy to have Dr. Sharad Lakotia ji with us today. He has done MBBS in KEL, MS in OP, HTH, and CAMS. He is an eye surgeon, contact lens, laser phaco, and microsurgery specialist. Ladies and gentlemen, Dr. Sharad Lakotia ji in 1986 established Lakotia Eye Center and Laser Institute. Recently, he has been joined author of the world's finest book on femtosecond laser with international faculty. He has also founded Eye Care Awareness and Foundation, which has been objective to promote eye care awareness to masses and to do free eye surgery for poor panelists with the modern facility. Respected sir, we are honored to have you with us today.
Thank you, Radhika, for a wonderful introduction. And today we are going to speak about COVID pandemic. Friends, as you all know that it is an international world pandemic involving 6.5 crore people into the disease worldwide out of 700 to 800 crores total population, and with a death of almost above 15 lakhs in the entire world. India too has not been spared. In India, we have found that there are more than 96 lakhs people who have been infected with the virus, and we have reported approximately there are still more than 4 lakhs active cases and 500 and above deaths we are finding even on a day-to-day basis, with a total of more than 1.45 lakhs death in our country throughout. That means it's a serious pandemic, and we have to ensure that we are safe. Friends, this has brought a lot of things into focus, into the way we think, way we live our life, and the total perspective. At one point, we are seeing is a scientific disease which has spread into the entire world, taking the shape of a pandemic, causing great disturbance in the present times, that we cannot just forget it, and it has affected our day-to-day life for such a long time. So how do we look at it? There are two ways of seeing the whole thing. One, as an intellectual, as a person who has to contribute to the society, we have our role to play in the most dignified way of protecting ourselves and others from the disease. On the other hand, learning the lesson from the world, that we have to be involved very knowledgeably and perfectly in things that we do. Don't play with the nature, don't involve, because there is one theory that it could be a biological warfare. So China and a lot of other countries are put into suspicion. A lot of things are coming up. So the most important lesson that our country has taught in years of benevolence, of sacrificing life to others, that is again being reflected, that they should be the most important motives for the human mankind. So friends, today when we talk about the disease, how it has progressed, how things are happening, we all know that the pandemic of COVID is not unknown to anybody. Everybody, even the small kid in a remotest village, has come to know and has understood that there is a serious problem which is affecting humanity. The mask, the social distancing, and the frequent washing of hands, as has been taught from time to time through different channels, through different media, has become a local mantra for the entire world, everywhere in the world, and India too. India is dominating and projecting in a much better way ahead of all, in best way. That's why we have been able to contain our COVID cases most proficiently as compared to the developed world, which still, like in US today, you are seeing that there are 2 lakhs 30 cases, fresh cases every day. Whereas in India, we are at least finding it much lesser. There may be around 40,000 cases or less than 40,000 cases every day. And as we all know that in Delhi itself, we have found that around 3,000 to 4,000 cases per day they are being reported, with over 5.8, or you can say 5 lakhs 80,000, around 5,000 deaths, around 5,800 or something, and then total deaths actually is 9,497, is more than 9,500. And this kind of scene, it just reminds us of one thing, that we have to be very careful. Now we have some of the finest personalities here joining today with us, who would be speaking about different aspects of COVID. To start with, I have one of the most brilliant and most academic, most scientific person. Dr. Anil Goel is with us. And he is a renowned personality in the sense that he has not only walked into the medical aspects so proficiently, but he has been into political arena as well, as he want to serve a major segment of the society. And recently he has contested the MLA election, which he lost by a very small margin. Dr. Anil Goel is a renowned urologist, and he is also a person for masses, as not only he is serving the community, but he is into top positions in the medical societies all over the country. He has been the he is presently the finance secretary of IMA, Indian Medical Association, which is the largest organization of doctors in the world, and he is also the past president of Delhi Medical Association. He is running a very big hospital of his own for his specialty, and he has been very kind to give his time to talk about what is the present strategy in treatment and management of COVID patient. So before we discuss other things, let's talk about what is new, what is latest, and what is the best that is available to an individual if he suffers from COVID. And Dr. Anil Goel is with us. I would request Dr. Anil Goel to kindly speak on this topic as long as you like. Thank you.
Thank you, Dr. Sharad Lakhotia, for inviting me in this webinar on Corona update. And my topic is, as you said, the treatment and management of COVID, and what is the update of COVID. Before I go into the update, I think this is possibly a public forum, as I understand. So let's give some basics, and then I'll go on to elaborating onto the advanced aspects. So we all know the what is coronavirus and what does it do. What is it? It is an RNA virus which has a sheath or fat sheath enveloped by fat sheath, and it invades the vasculature of the lung. As possibly previously we thought that it invades the lung parenchyma. Actually, it invades the lung vasculature and then destroys those vasculatures and causes the coagulopathy, intravascular coagulations, and then thrombotic phenomena, And finally, adult respiratory distress syndrome. Adult respiratory distress syndrome. So, how to diagnose? Possibly we all know, but I will go into a slight different mode. The anosmia of or the loss of smell or loss of taste possibly are the earliest symptom of the disease, and those patients who had anosmia or loss of taste had better prognosis. Possibly they do not progress to the adult respiratory distress syndrome. And the second most common symptom is fever, which is around 28%. And then is the fatigue, myalgia, upper respiratory tract infection, running nose. These are in the next symptoms in terms of their incidence. But this is upper respiratory tract. As you can understand, once the virus is restricted to the nasopharynx, nose, and upper respiratory tract, it is only a mucosal infection, so patient will not have shortness of breath or dyspnea. But when it goes to lungs, virus goes to lungs, especially in patients who are immunocompromised with diabetes, hypertension, kidney disease, follow-up cancer patients, and so on and so forth. Then, and immunocompromised patient, even without comorbidities, we are seeing more younger patients, especially in third phase of COVID in Delhi, that more and more younger patients were coming with without comorbidities, with pneumonitis, shortness of breath, with oxygen saturation going down to 90% and categorizing them into the severe COVID disease. And how we differentiate between three parts, this is divided into mild, moderate, and severe disease. What is mild disease? Mild disease means patient had fever, upper respiratory tract infection, but no shortness of breath. If you see his oxygen saturation, it will be more than 94% on room air, and respiratory rate would be less than 24, but normally say 16 to 20, it will be like this. So patient only had fever, upper respiratory tract infection, but has no shortness of breath, because our treatment will also depend on what kind of disease it is. Is it mild? And in case of moderate disease, the respiratory rate would be around 24 or less, and SpO2 would be somewhere between 90 to 94% on room air. And third thing is, or if you do X-ray chest, you will find pneumonitis, pneumonitic patches in his X-ray chest. See, so if these are the three things which categorize him or her into the moderate disease. While if it is a severe disease, in that case, patient's SpO2 would be short, other than shortness of breath, his SpO2 would be less than 90% on room air. And then there may be diffuse change, or what we say is ground glass opacities in in his X-ray chest. And if it progresses further, it deteriorates further, means that oxygen saturation is not going up to 80% even, then this possibly is a case of adult respiratory distress syndrome, what we call as ARDS. So once we have categorized these patients, why we need categorization? Because mild patients without comorbidities can be home quarantine, or maybe if they do not have place in home, can be sent to the quarantine centers. But if there is a moderate disease, he will have to be admitted in COVID care center, and in severe and ARDS, even in the moderate with comorbidities, they will have to be admitted in COVID care designated hospitals, what we say CCH, COVID care hospitals. Then what are the investigations which we do in such cases? What I suggest is any patients who has been found RT-PCR or rapid antigen positive. So first test in case of fever, URTI, any case of fever nowadays must undergo a RT-PCR test. For diagnosis of COVID, RT-PCR is presently a gold standard. Rapid antigen test, so which is done very commonly in dispensaries of Delhi government. Rapid antigen test should not be used for diagnostic purposes. It is a screening test. I mean, there for the follow-up, you can use this test. But RT-PCR test, which is accurate sensitivity about 70 to 80%, this should be used for the diagnosis. Once RT-PCR is positive, then other investigations including hemogram, urine examination is blood if he is diabetic, and a basic X-ray chest is must. And if fever continues for 3 days, then inflammatory markers like CRP, serum ferritin, IL-6, etc., are also to be done. Normally, in mild cases, these tests are not being done. So once we have decided it is a mild case on the basis of investigations also, we are asking patient to be home quarantine. The treatment in this case would be rest, adequate hydration, adequate nutrition, symptomatic treatment, say fever, paracetamol, and also the immune boosters like zincovit, saline, calcium, and antioxidants like mucinex, etc. So this would be the basic treatment here. Here, no antiviral treatment possibly will be needed, and this will subside in say 3 days time. Herein I would like to say that its incubation period is around 3 to 7 days or maybe 3 to 10 days. That means if you come in contact with a person who is infected, it should be the history of contact would be around 3 to 10 days before. Suppose I come in contact with somebody uh, 10 days back or 3 days back, I may become infected. And what is the contact? That is also to be understood. If we have around 15 minutes contact unmasked, then with the COVID patient, then possibly um, we will be at risk. And therefore, the prevention is also very important for all cases. Prevention means using masks, because nowadays the pollution is there. So we need to use the N95 mask without valve, and this needs to be fitted very, very efficiently over the bridge of the nose and down the chin, so that there is no loose space around. So that is why the people who are using mask but putting it below the nose is of no use. So we need to use mask very, very carefully. Second is hand hygiene. Third is respiratory hygiene. These are, and the distancing, the 6 feet distance, because we have no medicine. We have only prevention. Even if vaccine comes, it is only prevention. Specific treatment or specific antiviral drugs are still not available for treating corona patients. So prevention is very important. The mild case, home quarantine with supportive treatment and asymptomatic treatment. While in case of moderate disease, we will need to be admitted in hospital at times, because 90 to 94, all patients above 60 degree with moderate disease, admission is must. Even in young patients with SpO2 1994, I would rather suggest they be admitted to the ward, because the first few days of treatment is very, very important for these patients or COVID patients. The window of treatment where you can get success is initial 4, 5, 6 days, or maybe initial 1 week, where in moderate disease, other than the symptomatic and supportive treatment, we give oxygen support, we give other this Klaxin kind of things, that is, and the blood thinners, that is second part, and the steroids. These are again the mainstay of three treatment. One is this oxygen. Second is the blood thinners, Klaxin, heparin, low dose dextran, and steroids. These are three mainstay of treatment. And what are the dose? That will all depend on the disease severity based herein. A first CT scan is also done, HRCT is also done, so that we know the CT score. So what is CT score is that if it is below the 10, I'm just saying the roughly, if it is 10 out of 25, above 10 and above 10 or below 10, above 10, in that case, the treatment tocilizumab is also being added in those cases. So the CT score, first in the moderate and severe disease, in all hospitals, it is also done. So coming on to the severe disease, suppose it becomes a severe, then the dose is say doubled for the steroids as well as the blood thinners, and the oxygen support goes from say nasal cannula, so maybe NIV, non-invasive ventilation, or at rarely invasive ventilation. Most of the time we try to treat severe disease with prone oxygenation, awake prone. When patient is conscious enough, patient is not mentally confused, patient can understand. To awake prone position oxygenation with NIV, or maybe at times CPAP or BiPAP machines. These are and then flow may go up to the 15 to 20 liters or at times more, depending on the FIV required. We consider it that patient is going into ARDS. If he requires 90% or 100% FIV and the SpO2 still remains say 85 90, that patient has ARDS and poor prognosis, then he needs to be treated very very aggressively with certain 3 4 experimental medicines also, which we also give in moderate disease. But herein we give these experimental medicine. One of them is injection remdesivir, where 200 milligram IV is given on for day one, and then 100 milligram every next 4 days. Second is, and this also depends when you give remdesivir, possibly in or severe disease, we give remdesivir. Tocilizumab is another drug, which is immunoglobulin, which is given if IL-6 is say more than 100 in severe cases. And this is given in two doses also. The first is 400, then after 12 to 24 hours, if IL-6 is not coming down, then again it is given 100 to 200 milligram dose. Third thing is convalescent plasma therapy. Though ICMR has done a double-blind trial, and their study has said that this plasma, convalescent plasma, may not be of much help in reducing the severe disease to ARDS or converting moderate disease to severe disease. But still, they have said convalescent plasma can be given in moderate to severe disease patients. And then there are guidelines for that. This 15 to 60-year male can give given, the female who had never been pregnant can give this, and there is no much side effects. There has to be ABO incompatibility when it is being transfused to the patient, and there are few side effects for when we give plasma. As in blood transfusion, there may be side effects, hypersensitivity reactions, at, occasionally anaphylaxis also. So it needs to be given under supervision of the doctor in ICU setting. Obviously, these patients are severe patients. They are mostly in ICU with convalescent plasma is given. But we have treated till now around 500 cases, and I feel we are given 200 convalescent plasma also. I feel convalescent plasma, it is a good choice, but though it is debatable, it is still being labeled as off-label use. And then there are repurposed medicine also, as we have seen, hydroxychloroquine, and then antiviral oral Fabiflu also. So these are few major advances. But the major advances are, other than these, the oxygenation, where we have now high flow nasal cannulas, HFNCs, and the non-invasive ventilation has become the norm to treat these moderate to severe patients. And invasive ventilation in these cases is very, very rare. So coming on to the prognosis part and overall scenario, we all know that in India, the mortality is around 1.3 to 1.4%. And we are fortunate enough to have only a present situation only 35-40,000 case per day, which at one point of time was 90,000 to 1 lakh. And in Delhi also, what we are seeing is after third wave, where we have around 8,000 cases per day, and with 15% positivity rate. Now the positivity rate has come down to 5%, and then the number of cases are also to 3,000, and mortality rate is around 1.5%. So I think our doctors in Delhi are doing a great job. And at this point of time, I also want to pay my condolences to our COVID martyrs. In Delhi, we have lost around 40 doctors. In country, we have lost around 700 doctors. As a matter of fact, I'm just coming out of ardas of one of our lady doctor who died 3 days back, Dr. Indra Minucha. I pay my condolences to all the departed COVID martyrs. Once again, thank you, Dr. Sharad Lakhotia and your team, for giving me this opportunity. I'm here for any further questions or any answers. Thank you.
Dr. Anil has wonderfully explained everything, because this webinar is going to be heard by thousands of people, including doctors and general public. And your presentation has been such that it will be useful to all. So it's wonderful, as Dr. Anil Goel has been regularly contributing to all major TV channels on COVID. We are very fortunate to have him here in our webinar, and we thank Dr. Anil Goyal once again for his active participation and great contribution in making COVID understood. And very nicely, he has very scientifically explained all the facts and the present scenario. So we can see that he's in the car and he's a very busy schedule, and still he could make it. So that's a great thing. Now, coming next now is we are now going to rock. If you have any questions, we will definitely have questions, but I think Dr. Anil will be busy now. So we will be talking about other aspects. Now, let's talk about what is the COVID prevention measure, what we can do to prevent COVID cases. So it is very important. Three things which have been taught over and over again is mask, as has been very rightly mentioned by Dr. Anil Goyal, that N95 mask is used by those COVID warriors and the doctors, paramedical staffs who are directly coming in contact with them, with the COVID patients, and they have to protect. But otherwise, you can do those surgical masks which are normally available, or the cloth mask also. They will do your work. They will do your purpose. So it's not important to go for any specialized kind of mask, but your face and nose both should be covered. Again, this is very important. Sometimes the nose is kept open and people think that this is all right. Second thing is the social distancing, and crowded places you must avoid. And particularly when you are indoors and there is a lot of moisture inside, then there can be droplet infection. There can be a lot of other ways the virus can reach to the other person. So we have to be careful when we are particularly in closed spaces. We must maintain a distance, and it's better to avoid close places as much as you can. Going outside, you always wear the mask and maintain social distancing. And whenever you touch any object, you must wash your hands very frequently. About these things, we will have one of the finest speaker and a COVID a patient, a doctor who is directly dealing all the COVID patients in Vedanta Hospital. He has been managing them. He has been even those who are suspect COVID. He is taking care of them, and he is explaining to a lot of people all over the country. He is made a record of contributing his preventive policies and how to wash hands. This technique, the right technique, this technique has been explained by him at hundreds to thousands of different platforms all over the country. In fact, in at least 52 or 20 of them, I had the pleasure of to be associated with him. So I invite Dr. Shubhang Singh from Vedanta Hospital to speak about what are the ways of personal hygiene and hand washing techniques that one has to do, and what is his message. Dr. Shubhang Singh.
Good evening, sir. Namaskar. Thank you so much, Dr. Lakhotia, Dr. Anil Goyal ji, Shri Gaurav Gupta ji for inviting me to this platform. आज हम बात कर रहे हैं कोविड प्रिवेंशन की एंड नॉलेज, एटीट्यूड एंड प्रैक्टिस. हम समझते हैं ये तीन चीजें बहुत जरूरी हैं जिससे कि हम इस बीमारी से बच भी सकते हैं और इस लड़ाई को जीत सकते हैं. नॉलेज अभी बहुत सीनियर डॉक्टर्स ने आपको दी कि कोरोना है क्या, क्या लक्षण हैं, कैसे इसका ट्रीटमेंट होगा. हमारा एटीट्यूड क्या है? आर वी चेंजिंग, आर वी एक्लेमेटाइजिंग? क्या हम अपने एटीट्यूड में बदलाव ला पा रहे हैं, अपने बिहेवियर में चेंज ला पा रहे हैं? एंड थर्ड थिंग विच इज मोस्ट इंपॉर्टेंट इज प्रैक्टिस. वी हैव टू ब्रिंग सर्टेन थिंग इन प्रैक्टिस. उसे अपने जीवन शैली में हमें उतारना पड़ेगा. सबसे जरूरी जो बताया कि 2 गज की दूरी और मास्क है जरूरी. wherever you are going, don't feel offended. किसी को आप आज बोल देते हैं कि मास्क लगा लीजिए तो कभी कभार नाराज हो जाए. सो वो चीजें अवॉइड करनी है. वी हैव टू मेक इट अ हैबिट कि every time we are out we should use a mask. देखिए डॉक्टर साहब is very so it gives us a motivation. Wherever we are going we have to wear mask. It should be a properly fitted mask. सेकेंड थिंग विच इज इंपॉर्टेंट इज सोशल डिस्टेंसिंग. कोशिश करें कि अगर किसी से अगर लिफ्ट में खड़े हैं तो एक दूसरे के बैक को की तरफ हो जाएं, फेस टू फेस इंटरेक्शन ना हो. अगर डॉक्टर्स के चेंबर्स हैं तो एक स्क्रीन का यूज हो या आप फेस शील्ड भी लगा सकते हैं. उस तरह से कोशिश करें कि ड्रॉपलेट इन्फेक्शन को बचा सके, ट्रांसमिशन को बचा सकें. एंड थर्ड मोस्ट इंपॉर्टेंट थिंग विच इज हैंड हाइजीन. क्योंकि जो भी इन्फेक्शन हम लाते हैं, if we are out and we are, this virus is so egoistic virus that this virus is not going to step inside your house without you inviting this virus. So we are bringing this virus and this virus is coming in our hands. So try to do frequent hand washing. People often ask which sanitizer we should use. So either it should be more than 70% alcohol based or just ordinary soap and water. So if you are washing your hands with soap and water thoroughly, following all the steps, then we can assure you that you can prevent the transmission of this virus from your hands to your nasopharynx, to your mouth, nose and face. And we have to avoid this habit. एक बहुत हमारी गलत हैबिट है बार बार हाथ मुंह पे लगाने की, नाक को छूने की, मुंह को छूने की. दैट वी हैव टू अवॉइड ड्यूरिंग दिस कोविड टाइम. सो अभी डॉक्टर लखोटिया ने, डॉक्टर गोयल ने हमें बहुत ही अच्छे से एक्सप्लेन किया कि ये बीमारी क्या है, लक्षण क्या है, कैसे बने. अब हमें ध्यान देना है कि हाथ तो हमें धोने हैं पर कैसे धोने हैं. हाउ टू वॉश योर हैंड्स प्रॉपरली. सो फर्स्ट स्टेप, दिस टेक्निक हैज 6 स्टेप्स. टोटल इसके 6 स्टेप्स हैं. मैं एक एक स्टेप करके बताता हूं. फर्स्ट स्टेप इज, आपने सोप एंड वाटर लिया. इट इज पाम टू पाम, अपनी हथेली को हथेली के साथ. सो रब योर पाम टू पाम. स्टेप नंबर 1. स्टेप नंबर 2 इज बैक साइड ऑफ बोथ द हैंड्स, दोनों हाथों के पीछे, back side of both the hands. Step number 3 is interlacing the fingers. देखिए उंगलियों के बीच में interlacing the fingers, which is very important, जो इन surfaces को हम मिस कर देते हैं. Step 4 is just lock your hand like this and rub with each other so that back side of your hand is clean. Rub with each other. Step number 5 is thumbs. अंगूठे ना रह जाएं. Step number 5 is thumbs, इस तरह से thumbs of both the hands, दोनों हाथों के अंगूठे. एंड फाइनल स्टेप नंबर 6 इज राउंड राउंड राउंड. इस तरह से अपने पाम को, अपने नेल्स को साफ करने के लिए राउंड राउंड राउंड. स्टेप नंबर 6 इज राउंड राउंड राउंड. अगर इस तरह से आप अपने हाथों को वॉश कर रहे हैं, सो योर हैंड्स आर क्लीन, ये सैनिटाइज्ड हैं. अब जो भी आप एक्टिविटीज कर रहे हैं वो कर सकते हैं, बट फ्रीक्वेंटली इनको वॉश करते रहें. घर पे भी हैं, सैनिटाइजर, सोप वाटर, उसका इस्तेमाल करते रहें. डोंट अवॉइड. बट इफ यू आर एट पब्लिक प्लेसेस, फॉर एग्जांपल यू आर अ हेल्थ केयर प्रोफेशनल, you are going to a restaurant, you are going to a hotel or schools or educational institutions, it is very important, don't use the public towel, don't use the public handkerchief or the tissues which are there. So either you use your personal tissue or it should be disposable tissue. वहीं हम गलती कर देते हैं. रेस्टोरेंट में कोई टॉवल है जिससे 100 वर्कर्स आप पोंछ रहे हैं और हम लोग भी हाथों को पोंछ रहे हैं. दैट इज अ रॉन्ग प्रैक्टिस. अगर आपने हाथों को साबुन पानी से धो लिया, ये सैनिटाइज कर लिया, तो उसे अपने हाथ के लेवल से ऊपर रखें ताकि हाथ खुद से ड्राई हो जाए, नेचुरली ड्राई हो जाए. एंड नाउ यू कैन डू योर एक्टिविटीज. और सबसे इंपॉर्टेंट बात है इस बीमारी के बारे में कि हमें डरना नहीं है. अगर आप डर गए तो समझिए कि कोई कॉम्प्लिकेशन. तो अपनी एंग्जाइटी लेवल्स को कम करना है. हर चीज का सोल्यूशन है. इतने सीनियर डॉक्टर्स ने आपको बहुत अच्छे से समझाया. माइल्ड, मॉडरेट और सीवियर. हमें पैनिक नहीं करना कि कोविड पॉजिटिव हॉस्पिटल में एडमिट हो जाए. नो, डोंट एक्सपोज योरसेल्फ टू द हाई वायरल लोड. ट्राई टू स्टे एट होम. And India has given a beautiful example of treating millions of positive cases at home. Probably India is the first country where this practice was started, home care and home isolation. So आप घर पे रहें और जो भारतीय पद्धति का खाना है, चाहे गर्म सूप पीना है, काढ़ा पीना है, ताजा बना हुआ खाना खाना है, वो कहीं ना कहीं हमारे लिए फायदेमंद है. दूसरी चीज, डॉक्टर की मेडिकल एडवाइस जरूर लें, जरूर ध्यान दें उस पर. चाहे टेली कंसल्ट करें, चाहे वीडियो कंसल्ट करें, चाहे मैसेज पर ही आप उनसे जुड़े रहें. बी इन टच विद योर डॉक्टर बिकॉज दे कैन, जैसे डॉक्टर अनिल गोयल ने बड़ा अच्छे से फोकस किया, व्हाट आर द साइंस. जब आपको तुरंत हॉस्पिटल जाना है, डिले नहीं करना. दैट इज व्हेन योर ऑक्सीजन लेवल्स आर ऑन द लोअर साइड या कोई ब्रीदिंग डिफिकल्टी है. उससे पहले हॉस्पिटल जाने का पैनिक नहीं, घर पर जो भी सिम्टोमेटिक ट्रीटमेंट है उससे आप कोविड को मैनेज कर सकते हैं। और बहुत जल्दी वैक्सीन भी आ रही हैं और भी अच्छे समाचार आ रहे हैं, तो ये बड़ी समस्या अब बहुत लंबी नहीं टिकेगी। वी विल बी बैक टू नॉर्मलेंसी, बट या वी हैव टू फॉलो सोशल डिस्टेंसिंग, हाइजीन एंड यूज ऑफ मास्क वो नहीं उतारना है जब भी पब्लिक प्लेसेस पे हैं। एंड आई एम श्योर with positive attitude, with optimistic attitude, we'll be able to win this war. और जहां तक हम देख रहे हैं स्टैटिस्टिक्स, इंडिया इज डूइंग गुड इन टर्म्स ऑफ हमारा हॉस्पिटलाइजेशन रेट कम है, कॉम्प्लिकेशंस कम है, डेथ रेट कम है। अगर हम मिलियंस और बिलियंस ऑफ पॉपुलेशन को एनालाइज करते हैं, स्टडी करते हैं, एंड ऑब्वियसली इंडियन डॉक्टर्स आर वन ऑफ द बेस्ट इन द वर्ल्ड, दैट वी शुड ऑलवेज से। एंड द रोल ऑफ हेल्थ केयर वर्कर, रोल सिविक सोसाइटी, आज जिस तरह से पूरी कंट्री एक साथ आ गई है, चाहे बिजनेस कम्युनिटी है, चाहे पुलिस अथॉरिटीज हैं, ट्रैफिक अथॉरिटीज हैं, हेल्थ केयर वर्कर्स हैं, दिस इटसेल्फ हैज गिवन अ ब्यूटीफुल एग्जांपल कि किस तरह से वॉर जोन में एक लड़ाई को लड़ा जाता है। और मैं सभी मरीजों को ये कहता हूँ कि दो चीजें बहुत जरूरी हैं, एक अच्छा खाना और दूसरा मुस्कुराना। तो मुस्कुराते रहें, आपके जो अच्छे हॉर्मोन्स हैं वो अपनी बॉडी में रिलीज करते रहें। देखिए डॉक्टर लखोटिया की स्माइल से अच्छा लग रहा है देख के, तो इसी तरह की स्माइल आप सबके चेहरे पे होनी चाहिए। आई नो कुछ लोग मास्क भी हैं, तो भी मुस्कुराते रहें और एक अच्छा वातावरण, एक हेल्दी इन्वायरमेंट अपने पास क्रिएट करके रखें और सभी लोग स्वस्थ रहें। धन्यवाद।
Thank you, Dr. Shubhang. So nicely you have spoken about the ways one has to conduct. In fact, हम लोग कई बार बोलते हैं हाथ धोना चाहिए, लोग हाथ ऐसे ही धो लेते हैं, ये नहीं समझते हैं कि आपको 20 नहीं अब 30 सेकंड साबुन आपके हाथ में लगी रहनी चाहिए। और करेक्ट मेथड क्या है वो आपने बताया। ये हम लोग मेडिकल लाइन में तो बहुत तरह की हम लोग मेडिकल स्टाफ्स और इनके लिए तो हम लोग वर्कशॉप करते हैं जहां बताते रहते हैं, लेकिन आम पब्लिक को अभी भी पूरा एक्सप्लेन करना बहुत जरूरी है। और जैसे जैसे इन्फेक्शंस आ रहे हैं, इट इज वेरी इंपॉर्टेंट दैट पीपल शुड बी एजुकेटेड, क्योंकि एजुकेटेड होंगे तभी वो कर पाएंगे। और नई जनरेशन आगे पुरानी जनरेशन को रास्ता बताएगी। इंडिया आगे बढ़ रहा है और हम आगे, जैसे मोदी जी ने बताया कि आज के दिन हम वर्ल्ड के हर एक स्तर पे, किसी भी स्तर पे नीचे नहीं है, तो हेल्थ और हाइजीन भी हमारा बहुत बढ़िया मैनेज्ड है। इंडियन डॉक्टर्स, पर्टिकुलरली दिल्ली डॉक्टर्स ने बहुत बड़ा अच्छा काम किया है और चुपचाप अपनी सेवाएं प्रदान की है, जिसके कारण दिल्ली अभी भी स्वस्थ है इतनी। अदरवाइज तो बहुत सारी इंसिडेंट्स बहुत तरह तरह के हो चुके थे। तो इन सब से हम ये कह सकते हैं कि आज मेक इन इंडिया के प्रोजेक्ट में और सब तरह की चीजों में भी आपने जैसे अभी हेल्थ और हाइजीन का बताया, डॉक्टर अनिल गोयल ने लेटेस्ट ट्रीटमेंट का बताया, आज हम दुनिया को राह दिखा रहे हैं। हमारे यहाँ की वैक्सीन के बिना वर्ल्ड के अंदर वैक्सीन का नाम लेना मुश्किल है। और ट्रीटमेंट में भी अमेरिका जो इतना वेल स्टैब्लिश्ड और सबसे ज्यादा रिच और इकोनॉमिकली स्ट्रॉन्ग कंट्री है, उसके मुकाबले हमने कोविड को बहुत अच्छे से हाथ में पकड़ा है। जबकि यहाँ की कंडीशंस अलग हैं, यहाँ इतने तरह तरह के एग्रीगेट लोग इकट्ठे होते हैं। आज ही अभी देखिए धरने चल रहे हैं, कभी कुछ हो रहा है। इतनी मतलब समस्याओं के अगेंस्ट इतना बड़ा काम होना और इतना सक्सेसफुल होना अपने आप में है। और इतने इंटेलिजेंट डॉक्टर्स हैं इंडिया के और दिल्ली के, ये सोसाइटी को आज समझने की जरूरत है कि ये जो कंट्रीब्यूशन आ रहा है, इन्होंने कभी हक नहीं मांगा ज्यादा और कोई एक्सपेक्टेशन नहीं है, ये वॉलंटरीली अपना काम कर रहे हैं, ये अपनी इतनी सेवाएं दे रहे हैं, मेहनत कर रहे हैं। आज इंडिया में आपको वर्ल्ड क्लास मेडिकल फैसिलिटीज के लिए रुपी पे करना पड़ता है, डॉलर पे नहीं करना पड़ता है। अदरवाइज अगर इसको डॉलर में कन्वर्ट करें तो आप उनकी योग्यता का कुछ अनुभव कर पाएंगे। तो ये बहुत अच्छी बात बताई आपने, प्रिवेंटिव मेजर्स बताए, डॉक्टर अनिल गोयल ने बहुत बढ़िया एक्सप्लेन किया द करेक्ट ट्रीटमेंट। और डरना नहीं है, नॉलेज रखना है, जानकारी जरूरी है, घबराना जरूरी नहीं है। नाउ आई एम गोइंग टू स्पीक अबाउट आई एंड कोविड। नाउ फ्रेंड्स, as a president of Eye Care Awareness Foundation and as a past president of the Delhi Ophthalmological Society, I am just going to speak about how COVID is related to your eyes. Friends, are you aware that the first doctor, medical professional who got COVID And unfortunately, who succumbed to the COVID infection was an eye surgeon who got it from a patient while he was examined for glaucoma. And that was the first time that they came to know that it can spread through your eyes, through the tears. It can retain there and it can reach into the system and cause all the problems of COVID. So, friends, it's important to know what are the things that, from ophthalmic point of view, one has to take care. Conjunctivitis is one of the commonest manifestation of COVID in a patient who has suffered from the disease. In fact, there are variable number of reports. Some say up to 10%, some say about 1% of the COVID patient they suffer from conjunctivitis. But of late, it has been found, often missed, that even in severe cases, this organism is found in the tear film. That means that it can spread through the tear secretion. So one has to take care when you are rubbing your eyes. Inadvertently, either you may be injecting the virus into your system or maybe spreading to others. So everybody has to understand, because involuntarily several times we touch our face, touch our eyes without knowing what's happening. Now we have to be careful that you should take care when you are touching your eyes, at least your hands should be clean. Otherwise, you might spread the disease. And if you have redness, congestion, and if little bit of fever and all these things are there, it's important to treat, important to at least understand that there is a possibility and it can be treated. The second important thing during pandemic time is, now I'm not going to speak too much about the type. It's basically a follicular conjunctivitis, mainly affecting palpable conjunctiva. Sometimes chemosis and tear watering, all those things can be seen. Even in the late phases, there can be a lot of possibilities. So we have to carry on with the. Hello, can you hear? Yeah. So let's talk about what are the other possibilities. Now, during pandemic, we are finding that a lot of people are suffering in their eyes because of excess use of television. During pandemic, as we are having a lot of longer screen time, we are having a different kind of problem like dryness in the eyes. This is dry eye disease, or it is also known as computer vision syndrome, which is because of excess use of technology. So if you are having more screen time, there is a possibility that there can be dryness in your eyes. Now, for this, you have to use lubricant drops and you use a principle of 20. That means if you are working on screen for a long time, so after every 20 minutes, give a break of 20 seconds, look at far off object 20 feet apart and blink frequently at that time. This will help. So this is very important, those who are having. And those who have small refractive errors, they may get headaches also. So it's important, if the symptoms are not getting controlled, then you see an eye specialist. Friends, now I have to speak one more aspect about the vaccines that are available. You all know that there are several vaccines available in Delhi. In India, in fact, two vaccines are very much there which can come to our rescue. One is that Covishield, which is made by Serum Institute, and second is Covaxin with Bharat Biotech. Also, Zydus Cadila is making Zycovid D, which has great prospects. So now all over the world, the vaccination has started. On Sunday, today, we find that Saturday already in Russia, the vaccination has started on a very emergency basis. And tomorrow, no, Tuesday, in Britain, you will have the Pfizer medicine, which will be there. Now, all of us know that Pfizer medicine and Moderna from USA, they are in the forefront for being the number one COVID vaccines in the world internationally, and very soon they may get a short approval for a limited usage. And also the Russian Sputnik vaccine with Dr. Pat's lab, it's also promising future. And the Chinese vaccines are also claiming to have, they have used in Bahrain, they have already done a lot of cases, so they have a lot of prospects. So the short of it is that the prospects of vaccines are very good. They will help prevent, but how much they will prevent infections from one person to another, time will tell. How much antibody they will produce, how long will it last, which is also time will tell us. But we are very promising about these vaccines because they are the only thing that can change the entire scenario of COVID in the world. And maybe we are very sure that pandemic worldwide will be under control very soon. Now, I am going to invite Mr. Gaurav Gupta, who had been a corona warrior. He has suffered from COVID and how he came out. And I have to tell you in an introduction that he has been a great pioneer to the society in various activities. He is president of Lions Club Vegetarian. He is president of Rajasthan Academy, and he is associated lot of organization. And now in COVID times, he is doing lot of activities. So he will tell you experience how he came out of COVID and the points which can be important to general public. Mr. Gaurav Gupta, please.
Very good evening, Dr. Sharad and Dr. Shubhang. Thank you very much for inviting me, and it is a really honor for me. We are blessed. You rightly said that India is blessed to have good doctors and good knowledge of medicine before this COVID also, and I hope India is coming up a big leader in the medical field. We are blessed to associate with a doctor like you. And when we got COVID in June. In my whole family was affected. We are four, me, my wife, and two sons. On 14th of June, we feel we have some fever. We don't have the idea how we get, because we are being a good warrior. We are serving to the society, going to the field also, going outside, for the distribution of food also. But when we got the fever, we connected with the Dr. Shubhang, Dr. Agarwal, and many doctors with us, associated with us. So they suggested us to go through the whole procedure. Dr. Shubhang is kind enough. He made a whole chart of all the medicine, and my son is constantly in touch with him. On 19, we got the test first. Some people say, not the doctors, but some people, friends say, don't go for the test, because then it will put a bad name also. You will get the poster outside your home. Because that time the cases were very less in the whole Delhi, and in our colony also there were not a single case was there. But and we all four have the different symptoms. I was having fever. My wife, all three were having the fever. The younger son has no fever at all. Neither he has some bad throat, nothing. And we shipped him to the first floor. We thought he was okay, so he should not be touched with us. So he should keep away. My wife had a bad throat. and my elder son Shubham had the fever only. But when we got tested, we took our younger son also. Surprisingly, he was also positive. So we four were positive, and we follow the medicine and diet chart as referred by the doctors. But unfortunately, my position is getting worse. When we got our oxygen oximeter checked, my oxygen was 91 to 92 always, and the fever is rising day by day. After 9 days, everything is going to be okay, but my fever is not under control. It is going to 102. So doctor suggested me to get the X-ray and the blood test at home only. We get the test, but then it was not clear. So then we go for the refer for the CT scan. Then CT scan made the picture clear. It was a pneumonia. Pneumonia. It is getting worse. So doctor advised me to get admitted immediately. Fortunately, I got the admission in the Sarvodaya Hospital, Faridabad, and there I was given the all the procedure, medicinal procedure, which just Dr. Anil Goyal discussed. I was given the blood thinner. I was given the oxygen, and that time the remdesivir injection was about to come, and they were readily available, and I was fortunate to get. I was given 6 injections, but I have heard somewhere that it is now not in their severe list. Can you elaborate in that, Doctor Sir? What about, because I got the remedies treatment. Hello.
Yes, continue,
Yeah,
continue.
sorry. Remdesivir treatment was given for 6 days, and after 8 days, the fever was controlled, and luckily, I was discharged from the hospital on 1st of July. So they say, "And is well, all is well." But in the meantime, when I was admitted, they were getting very bad news also. Some young people, some old people are not able to recover. But luckily, we got recover. And took it as other way also, because I had some past history also. I had tuberculosis problem from my childhood. So maybe some lung problem I was already expecting. So when the this thing occurred, COVID attacked, so I got some cough problem also, and the fever was high. Uh, but I take it is a good lesson. We took the all good food, and we were positive enough. And doctor has advised us well, and we are thankful. We are blessed to have such friends and family and doctors like that. And Dr. Shubhang is also very helpful always. He's just call away. Maybe he has given advice to hundreds of friends and family members of us. And like Dr. Wali, Dr. Agarwal, and Dr. Lakhutia ji, we are at that, even at that time I was busy in the webinar only. Before going to hospital, I didn't disclose that I am not feeling well, because there was fever only 100 and 99 100, but I was continuously available on webinar. So I took my normal life, keep going. I think the coconut water is very good for the any illness. Whenever you feel low, or you are, I do much of liquid, because when you lost the taste, you're not liking the food, or you cannot eat much. Liquid is very good. That time fruits were there, fresh fruit. We got lime juice and other things like that. And luckily, our whole family is good now. And it is almost 6 months going to complete. So we are all well. And we pray to get the injection soon. And the word should come out of this hell. And this pandemic is a great lesson for everybody, by emotionally, physically, mentally, or financially. So hope for the best. Thank you, doctor, for calling me. And just want to inquire about this remdesivir thing. Thank you.
Yes, we will discuss about. Yeah, Dr. Shubhang, what is your comment
So
on
see,
remdesivir?
yeah. See, every patient doesn't need remdesivir or tocilizumab or plasma therapy. It is the clinician's decision. You know, some patients they develop dyspnea. Unka oxygen level goes below, despite their CT is not showing major changes. However, some people have mild disease, and even the CT severity score, as Dr. Goyal mentioned, is above 10, or if we are seeing it on the 40 scale, some above 15, but they don't develop any dyspnea, they don't develop fever, you know, their immune response is good to it. So the decision of giving remdesivir solely depends on your clinical picture and the decision by the treating doctor. Some patients, they are good with oral medications, maybe oral steroids, like they are giving dexamethasone, Medrol. So patients are getting better with that, and many elderly patients like we have treated at Medanta's isolation center who were above 80, even with comorbidities, they did better because the symptoms were less or the timely, blood investigations and the scans were done. So I believe early diagnosis and prompt treatment is very important. We should not neglect.
One point.
If your reports are
Wha-
normal, very happy, but you shouldn't think that doctor is over investigating or doctor is unnecessarily asking you to get a CT scan. I have seen cases where patient was completely asymptomatic, but on CT scan we have seen pneumonia, and later on they deteriorated maybe after 8th or 9th day. Like Gaurav ji is this thing. Later on they developed pneumonia this thing because after 7 days. So 7 to 14 days, these days are very important, very critical. So you should be very watchful because initial 7 days, anyhow, you pass. One day you are diagnosed, then after 2, 3 days, you get the test done, report comes, you start flu and other medications, you are taking symptomatic treatment, CADA and home remedies, so you are fine with that. But from day 7 onwards, I believe you should be in daily touch with the doctor. So hospitals have a home care program. If I'll talk about Medanta, so they also have a home care program. You can be in touch with doctors every day, either through WhatsApp, video calling, or the Zoom, this thing, so that you feel connected and you get a call from a healthcare expert who is dealing with sick patients, and they can really tell you on time, like get admitted to the hospital, don't delay. Get CT scan done now. Get blood tests like inflammatory markers, D dimer, CRP, ferritin, etc. So you should be very careful with that. And importantly, which I have seen, the control of diabetes and hypertension is very important. So people are having, uncontrolled diabetes nowadays because from last 7, 8, 9 months, they are just sitting at home, eating, not doing regular exercise, and many of them are depressed. Depressed maybe because of economical reason, social reason, psychological reason, familial reason. So that's what I'm telling, that you need a healthy environment. And probably at home, if good care is given, for example, you can call a nurse. Now there are many organizations who have come forward. Initially, there was a fear. Nobody want to enter a house where there is COVID. But now nursing care is available, elderly care is available, doctor's visit at home is available, and through video call. The information technology is playing a very good role. Like a doctor who was supposed to treat 500 patients now is able to treat 1,500 patients just because of the help of IT, because he can just sit at the comfort of his clinic and he can advise more and more patients. So I believe with a a multi-system approach, involving the enthusiasts from the civil societies as well as the healthcare professionals, and early diagnosis and prompt treatment is the key. So test, track, and treat. If we are testing more, tracking more, and treating more, for sure we'll be able to end this pandemic soon.
Wonderful. Wonderful, Dr. Shubhang. And one important thing I would want to mention, which goes well with what you have said and Mr. Gaurav Gupta's personal credentials. Spirituality is very important. Meditation and spirituality helps you a lot because it's a time of anxiety. You mentioned that keep smiling. To keep a smile all the time, you have to be spiritual person. That is only possible. I know Mr. Gaurav Gupta, who has organized a series of lectures on Gita Gyan during this COVID time, and this was maybe the source behind that any medicine could have helped him because that was his will to fight the disease. And immunity by this spiritual mean is very important, which is recognized worldwide. Why there is a variation that a younger person has succumbed and a little older patient has been able to win over the infection even in a moderate to severe disease? So this is because of this. So I would say that immunity by diet, proper food, everything is important. But spirituality, meditation, yoga, pranayam, walking, exercise, they have a big role to play, not only in COVID times, post COVID as well. Now, we conclude here the session, and I am grateful to all the top speakers and our wonderful panelists who have contributed. I would like to tell you, Delhi Medical and Dental Society has been organizing doctors awards functions, camps and other things from 1990. the organization Eye Care Awareness got registered in 1995, and Eye Care Awareness first time they awarded doctors as Human Care Award of the Millennium in 1999, and we are very proud that among those at least 20 got recognized by government as Padma awardees. Many became MLA, MP and union minister of the country. So this is my privilege that at that time, along with Chief Minister of Delhi, I awarded these doctors. They are in a function at India Habitat Center, and since then every year we are organizing award function for the doctors, the Corona warriors who have been selflessly helping the society, and we have been doing this, we continue doing this. So friends, anti-corona task force, where I am also a consultant, also Eye Care Awareness Foundation and Delhi Medical and Dental Society, where I am the president. I once again thank you all for patient listening, and I'm grateful to all the panelists, Dr. Shubham Singh, Dr. Anil Goyal, Mr. Gaurav Gupta, who have contributed so well. Mr. Vinay, Dr. Vinay Agarwal, who was to be present here, today he had fever, so we asked him to take rest and not to involve. And this message goes that if your health is not all right, if you are feeling feverish, stop everything, take rest, and be comfortable. So thank you very much. And once again, thank you and bye bye. It was a wonderful time to speak to you and to communicate. Thank you. See you in the next webinar.